Hey y'all, it's Ashley. Aloha from Hawaii. As you can see in the background, I live in a very tropical, gorgeous place now. I spent some time doing mantras and just really positive thinking and really honing in on what was important to me and what I felt like I was supposed to be doing. And I ended up here. So I've been living here for a few months. That is why I've been quiet as of late, but I hope to start a lot of new material soon. And today I decided to maybe give you a little bit of a picture of what it's like to have the cranial um, decompression and fusion of your C spine, so it's all the way from the crown of your head down to your shoulder blades. Um, just in case there are people that are wondering if it was helpful or just kind of the process of everything. And I am now 30, and I had it done when I was 21, so about 9.5 years ago. Um, I went to the Chiari Institute in Long Island, um, and before I was determined to have the surgeries, I actually did not have a diagnosis. I went to the Chiari Institute because no one could figure out what was wrong with me. So I went to 2 or 3 days of testing where I had MRIs and CAT scans done and the neurological testing where they, like touch your fingers and you have to count backwards and you have to say certain things. It just tests your, neurological state. And none of it was painful or anything of that nature. Um, so, as I was saying, none of the procedures or testing was painful at the get go. If they do determine that you have to have the cranial fusion and decompression, I know it's really stressful and scary and a lot to kind of think about, but for me personally, it was incredibly worth it. Prior to the surgeries, I was to the point where I could barely walk. I was barely able to formulate sentences or figure out what words I was trying to say. They would always be kind of at like the tip of my tongue, but I couldn't get them out. I was in excruciating pain. I was having bowel problems. Um, and keep in mind that I also had a tethered spinal cord, so I had surgery on that as well when I was at North Shore Long Island Jewish Hospital in New York. I had all the procedures in a row. But essentially, I feel like the surgeries were worth it. The part also that could be a little bit scary is when they figure out how far up they have to fuse your neck, um, they put you to sleep and they put a metal halo on your head. So it's kind of like a little Frankenstein metal halo, and they put screws to anchor it in. They put, I believe, local anesthetic in the spots where they screw it into your skull. Um, when you wake up, they have you with the halo on, and they wake you up in recovery, and you just sit up in bed, and then they attach kind of like a weight to see how far up. Um, they need to fix your head permanently, and that's determined by your vital signs, if you're breathing better, if your pulse is better, if your blood flow is better, if your cognition is better. And you kind of get to do like a, yay, that feels better, or that feels worse type of thing. Um, and for me, I found that I was able to breathe much better um, and swallow a lot better. So those were the two defining factors for me, as well as not having um, an excruciating headache like I normally did for 21 years. Um, and so once they figure out what the measurement is, they put you back to sleep just for a little bit, and they take the halo off, and then they schedule your surgery. For me, I had my tethered cord surgery first, which is not always indicative of Ehlers Danlos, but in my case it was. Um, and they shaved down my vertebrae, which the spiny part is usually what sticks out, and that's what they shaved down. And also for me, they untangled the nerves that are supposed to fan out at the base of your spine. Mine were all kind of like mangled and tangled, so they fanned them out and then they shaved down the vertebrae. Um, After that surgery, I woke up in the ICU. I don't recall being in a whole lot of pain. They do typically put you on a morphine pump, also known as a PCA pump, for a little while afterwards. Maybe a day or two at the very, very most. It is vital that you get up and walk around, even if you feel so tired or so dizzy or, whatever. Um, have your family members or friends or whoever is advocating for you make you get up out of bed, because the more blood flow you have going through your body, the faster it's starting to heal and the faster they'll let you out of the hospital, because I personally don't like being in the hospital. So that was a huge factor for me. I remember crying and not wanting to do it, but my mom kept pushing me and saying, if you want to get out, you have to get up. So I walked around with the IV pole, I think, a little bit. They keep you on fluids for quite a while because it's a lot of trauma for your body. Do expect that you won't be able to poop for probably a week. The anesthesia makes your bowel movements incredibly sluggish, and from the natural healing standpoint, it's really important to drink so much water and to eat relatively easy to digest foods like sweet potatoes. What else? So then I have another round of surgeries, which were the cranial decompression infusion. I think I had those about 2 weeks after my initial surgery on my lower back. They didn't want to do them too close because they wanted me to be able to heal properly in between. So I went and stayed at the Ronald McDonald House in between, and was just able to do that way. So then I went directly back, and so at North Shore, my experience was that they gave me a lead time because I was on a waiting list. They gave me a lead time of maybe like 6 hours. So I kind of waited till later in the day every day to eat breakfast or lunch because I wasn't sure if I was going to get the call to go in for surgery. And if you've eaten that day, they likely won't do the surgery because you can't have food in your stomach when they put you under. So that's kind of a thing to think about. And also, um, I guess you kind of mentally prepare yourself as well. It's kind of a scary thing to do. Um, for me, I just wanted to have a better quality of life. My quality of life was so poor that I was barely functioning. So for me, the risk of going into surgery and all of the complications that came with it was a risk that I was willing to take. And quite honestly, um, I just wanted to live at that point. So um, I just went for it. You know, that's my personal opinion about it all. Is I was suffering so much before the surgery. So what did I have to lose? So that's why I decided to do it. So I had the surgeries, and I believe I went in around 8 or 9 in the morning, and they put you under. I believe they're supposed to put you under before you go into the surgical suite, but for me, I was awake. Um, I would really encourage requesting that they put you to sleep before they take you into the surgery room. It kind of scared me a lot because I looked around and there were saws and drills and screws and pieces of metal, and it was just a bit overwhelming. And I'm not sure that was a common practice, but I would make sure to speak up and say that you want to be put under, maybe in the waiting area first, possibly. So then I think I was under for maybe anywhere between 8 and 10 hours. I don't quite remember. I shouldn't remember, I was asleep, but um, my mom was in the waiting area, but I believe it was like 8 or 10 hours. And during that time, they did the cranial decompression where they drilled or sawed actually the back of my skull open. I think they kind of cracked it open a little bit, and they put the rods to fix up my neck. They kind of go like this and like this, and there's little screws. Um, and then, so that there was enough room and that they decompressed, they then put some, I believe, like bone mesh across the back of my head. So my head's like almost, maybe an inch and a half wider than it was before um, because of that mesh. And um, when you wake up from the surgery, kind of expect to not really know what's going on or where you are. I liken the first day and a half maybe to being on mushrooms, to be honest with you. Um, you're not sure where you are, you hear voices, but you can't really open your eyes. You're in a considerable amount of pain, but you're also on the morphine pump again, so the morphine just kind of makes you so out of it that you can feel the pain, but it's not enough to make you cry because you're not super aware of it, if that makes sense. Um, and again, I had a catheter for the first day and a half or 2 days. They will probably give you Lasix, which drains the extra fluid off of your body. And keep in mind that there's a chance that when they make you stand up for the first time out of bed, that if they give you Lasix, that it's going to overwhelm the catheter and that you might leak onto the floor. It basically feels like you're peeing on the floor, to be honest with you. But just, I guess the nurses maybe expect that. So that's a little embarrassing, but I felt better afterwards because I wasn't swollen anymore, so that was good. While you're laying in bed, you typically have the IV fluid and morphine going in here. Sometimes you also have a blood pressure cuff on, and maybe sometimes heart monitors, but shouldn't be typically a thing. And then you also have the compression stockings that go from like here down to here on both legs, and they puff up like a blood pressure cuff, and they squeeze your legs, and then they let go, and then it's that kind of thing to get the blood flowing through your feet and your legs, because otherwise it can pool, and that also promotes healing. I recall being in the ICU for maybe a week. I'm sure it depends on the facility. They typically try and push people out as fast as they can, which I don't completely agree with. However, healing at home, I think, is also more therapeutic than trying to heal in the hospital. Um, Getting up and moving around, again, is a huge thing. The pain medication will probably make you feel pretty sick to your stomach, so you're not going to want to eat, but pushing yourself to do that, again, is really important because it helps your body start healing itself. When you wake up from the surgery, on the back of your head, so they shave the whole back of my head. It's a good excuse to shave your head completely and have some sort of cool party, if you're a woman especially. They shave the whole back of your head. There's a whole strip gone underneath your top layer of hair. When you wake up, they'll probably have like glue. It'll be all matted. I encourage, quite honestly, the shaving the head. It would make life much easier. And you'll wake up with a tegaderm on the back of your head. And a tegaderm is a really big, long, well, they come in different sizes, but a big, long Band-Aid that just seals around the edges and is kind of like open in the middle. So it's not stuck, all the way down. It's just stuck around the edges to stay on the back of your head. And your head might feel like it weighs 80 pounds or something wild like that. The muscles in your neck are going to be really tight and tense all through here and like through your jaw. You'll still be bleeding a bit out of the back of your head. Um, and I highly, highly encourage having, again, a friend or family, whoever's advocating for you, really take the time to ask the nurses for clean like sheets and pillow linens every day, because it reduces the risk of infection. And I didn't have an infection, but another woman who had the surgery at the same time as me, she got an infection. Um, and I really feel like if someone's there advocating for your care, then it changes a lot of things. Um, because the nurses have a lot going on. It's not that they're trying to ignore you or treat you poorly or anything. They just have a lot of patients to tend to, and I think it's sometimes honest mistakes that happen. But so the clean bed linens every day, having someone there to make sure that you're getting your pain medication on time is crucial, because if you go like 20 or 30 minutes past when you're supposed to get your pain medication, um, during that first week, it just like lets the pain flare back up and it gets really intense, and that can feel really, really uncomfortable. Um, Another thing to pay attention to, just as an aside, is be really aware what type of personality you have as far as addiction tendencies. I don't have an addictive personality when it comes to things like that, so I didn't find it hard to wean myself off of the medications. However, when you do start to feel a little bit better, you recognize that um, if you don't take them religiously, the pain starts to creep back in a little bit. But I eased my way off of the pain medication um, because I knew how hard it was on my system, and I started to recognize how good it made me feel. And so that actually made me want to get off of it faster, because my body was getting used to that kind of euphoric pain medication feeling, and that's how people get addicted to it. Um, so just be really aware with yourself and kind of push yourself a little bit. There are a lot of supplements that can be taken to ease and deal with pain that are completely herb-based and natural, and I would very, very, very much support introducing those as you're weaning yourself off of traditional pain medication. Um, and when you wean yourself off of the traditional pain medication, you may find that you are highly irritable, that you are having like nightmares when you're coming down off of them, especially the morphine, and that you're sweating a lot. So again, drinking a lot of fluid and introducing some natural means of healing is wonderful. You can use something like topical, like if your suture is hurting, like arnica. Arnica is very healing, or anything with calendula in it is incredibly helpful to heal the scars and just kind of like the surface pain. It can get aggravated where the staples are. I personally had a thing where it kind of felt weird where the staples were, and so I found myself kind of like picking off the scabs, and I highly recommend not doing that, because it heals faster when you don't do that, and then also it leaves like bigger scar marks where the staples were, um, and it's just important basically not to touch it. Another very, 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 very important thing I cannot stress enough is letting people touch you and massage you. I didn't really have anyone around that was comfortable doing like the neck massages on me, but if you have someone that's able to do those neck massages and like releases all the way along this kind of ridge down here, it will help release the muscles. And it's so important because even to this day, mine are not all the way released, and it causes me some problems all along here. So having someone massage that every single day is absolutely crucial. You are pushing the blood flow and you're releasing those muscles that have been traumatized from the surgery. So I can't stress that enough. If they give you a script for physical therapy, use it. Use it, use it, use it. Physical therapy is amazing, and sometimes that will include getting those neck massages by someone who is technically trained to do so. So that's a huge deal. You may also find after surgery that you're feeling besides feeling completely lethargic, trying to recover, you might feel a bit depressed. It's kind of like, you feel like a train hit you, and you know that you're supposed to feel better, but you're not quite feeling better yet. Be super gentle with yourself and let yourself heal, but dealing with the depression, to me, that is caused by the trauma to your body and probably how long you've been sick before the surgeries, as well as all of the drugs that they put in your body, completely mess it up, to be honest with you. And I went on a regimen of supplements, and I wish I would have known about it immediately after surgery, but I didn't. And it included a supplement called True Balance, a fish oil supplement, amino acid supplement, grapefruit seed extract, and I would truthfully say probably something called PS, and PS is a short acronym for some long word that I can't remember right now, but if you Google it as a supplement, you'll find it. All of those are mood stabilizers, and also stabilize like blood sugar and our ability to absorb the nutrients from the food that we are eating. And those are all key to healing, because if we've had the trauma to our body, the morphine and the antibiotics pumped through our body, and the pain meds, and we've been sick probably for years, our body is completely exhausted and depleted of the happy like serotonin and dopamine stuff that is supposed to support this healthy mood in us. So I would highly advise that. If you want me to, message me and I will give you the exact list that I was using, and some of those I still use to this day. They're essential to me, and I'm pain free, so yay to that. But if you want any specific tips about healing from the surgeries kind of in a more natural manner, message me or find my Facebook or look at the other videos, because I wish someone would have told me about all of this stuff. But I'm glad that I could really pass it on to you all, because I think it's essential. So that's my experience of the cranial decompression infusion and the lumbar laminectomy, and kind of the things to help the healing process. And again, if you have any questions, get back to me. And just looking at my background right now, it just reminds me that I've come so incredibly far, and I still have really far to go. It's a goal of mine to educate and help anybody that I can. So, but this is a reminder to not give up on your dreams and what you're interested in, because I live in Hawaii and I'm from the Midwest, and my life is absolutely incredible, and I'm so thankful for it. So this is just a reminder also to not give up on all of the wonderful things that you wanted to do in this life. So I hope that you all are well, and I will put up some more videos soon. Namaste.